Hi, Ms. Smith. I'm Erica, your nurse today. And before you are discharged, I just want to talk to you a little bit about your medication that you're prescribed to and why you're prescribed to it. So, while you were in the hospital, you were diagnosed with primary hypertension, which is super common. A lot of Americans have this disease, and we don't necessarily know why it's caused, but in your body, there is a system called the RAS system, and it signals for certain chemicals to be released in response to blood pressure, and for some reason, your body is like sending abnormal signs and sending the wrong chemicals, and so we need this to stop happening because we want your blood pressure to be lowered, because hypertension can cause other severe issues like increase your risk for heart attack or stroke or heart failure. And so because of this, we wanted to prescribe you to valsartan, which is an angiotensin receptor blocker, which means that it blocks angiotensin 2 after it's formed, which causes vasodilation. And then ultimately it increases your sodium and water excretion, which then lowers your blood volume or blood pressure. But with valsartan, it also has some side effects. So first of all, I just wanted to make sure you aren't pregnant, because you cannot take valsartan if you are pregnant. And also, we recommend that you are on some sort of oral contraceptive if you're taking valsartan, just for any risk that you do get pregnant. And then also, I wanted to make sure that you didn't have any history of renal disease or like kidney history, because this medication has an adverse effect that can worsen previous renal failure. And then lastly, I just wanted to let you know that there is an increased side effect of angioedema, which is swelling like under the lips and like right beneath the skin. So I just wanted to let you know about that. And then also, like we said, we don't really know why hypertension happens, but it can be prevented or helped prevented with like if you stop smoking or decrease your alcohol intake, decrease your sodium intake. So I just want to remind you to try not to smoke or drink alcohol if possible, and then also to try and eat at home instead of eating out, because a lot of times when we eat out, your sodium intake is higher because a lot of processed foods have more sodium, so it would help a lot if you would eat at home versus eating out. And then once again, I just wanted to remind you that you cannot take valsartan if you're pregnant or if you have any maybe like potential of getting pregnant, so that's why that oral contraceptive is super, super important. But other than that, I'm hoping valsartan will help lower your blood pressure. We're going to see you back in a few weeks so that we can monitor and see if the medication is working and if it's lowering your blood pressure. You can also, if you have a cough at home, you can take your own manual blood pressure just to like monitor it day by day. But if not, that's totally fine, and we'll just check it when you come back in the next few weeks. But I know that was a ton of information, so if you have any questions, just let me know and I'd be happy to help.